Good morning, guys. I have discussion A for you. We are discussing holistic healing for today's A. So join me in today's presentation, please. Sit back and enjoy. More people are choosing holistic healing because it treats the whole person, emphasizes root causes and prevention, offers accessible non-pharmacological options for chronic stress and illness, and aligns with a cultural shift toward mental health, self-care, and lifestyle medicine. Holistic care feels like a return to something people since they've lost time, attention, and a sense of being seen as a full human being rather than a diagnosis code. Why this shift is accelerating. Give me 1 second here. Root cause focus. Many people are tired of quick fixes that mask symptoms. Holistic practitioners often explore sleep, nutrition, stress, trauma, history of gut health, and environmental factors to understand why symptoms appear. Mental health awareness, anxiety, burnout, and chronic stress are at historic heights. Mind and body practices like meditation, yoga, tai chi, and breath work lower cholesterol, improve emotional regulation, and help people feel grounded. Chronic illness, frustration, conditions like autoimmune disease, chronic pain, IBS, and fatigue often don't respond fully to conventional care. Holistic approaches offer personalized plans and complementary therapies. Desire for natural options, concerns about medication side effects, long-term dependency, and over-prescribing push people toward herbal medicine, nutrition therapy, and natural therapies. Cultural and ancestral healing, reassurance, indigenous Eastern Give me 1 minute. And ancestral healing traditions are being reclaimed and respected, especially among younger generations seeking meaning and identity. accessibility through digital platforms, telehealth, mediation apps, and virtual yoga and online coaching make holistic care easier to try than ever. What holistic healing actually does for people: prevention and lifestyle medicine, diet, movement, sleep, and stress management are the pillars of long term health, and holistic care puts them front and center. Mind and body integration practices like mindfulness, somatic therapy, and breath work have strong evidence for reducing anxiety, depression, and chronic pain. Patient empowerment. Instead of being passive recipients of care, people learn skills they can use daily: self massage, grounding techniques, nutrition strategies, sleep rituals, community and connection, group classes, circles, and workshops create belonging, which itself improves health outcomes. What to keep in mind before diving in: check the evidence. Some modules, some man, some modalities, mindfulness, acupuncture, nutrition therapy, have strong research. Others rely on more tradition. Verify practitioner training. Credentials vary widely. Look for licensure, certification, or reputable training. Coordinate with your clinician, especially if you're adjusting medications or adding herbs that may interact. Avoid miracle claims. Holistic care can be powerful, but no legitimate practitioner promises instant cures. A sample way to begin: start with mind and body practices, 5 minutes of breath work or meditation daily. Upgrade to sleep hygiene, consistent bedtime, light reduction, wind down routine. Add one nutrition shift: more whole foods, fewer ultra processed ones. Move gently but consistently. Walk, stretching, yoga, tai chi. Track what changes: mood, energy, digestion, sleep, pain. A focus on a focused, practical, emotional healing plan blends daily mind and body practices, weekly reflective work, and gradual exposure to uh, relational and meaning making activities. Start with 10, 10 to 20 minutes daily and track three simple matrix: mood, sleep, reactivity for 6 to 8 weeks. Primary goal: reduce emotional reactivity, increase resilience, or process past trauma. Choose one to prioritize. Safety: if you have active suicidal thoughts, severe disorientation, disassociation, or uncontrolled substance use. Seek professional care first. Integration: combine this plan with evidence-based therapy, CBT, DBT, when possible for best outcomes. Behavioral health news. Core principles: why this works. Mind and body regulation, breath work, yoga, somatic practices lowers psychological arousal and supports emotional regulation. Narrative and reflection, journaling, therapy help reframe meaning and integrate experiences. Social and purpose connection strengthens resilience and reduces isolation. 8-week holistic emotional healing plan. Daily 10 to 20 minutes. Morning 5 to 10 mini breath work. Box breathing or 4-4-6 pattern to down regulate stress. Track morning mood. 1 to 5 holistic online. Evening 5 to 10 reflective journaling. 1 sentence about what felt hard, 1 about what helped. Track sleep quality. Hours plus restfulness. 3 weekly 30 to 45 minutes. Movement with inter repetition. Gentle yoga, tai chi, or somatic movement. Focusing on sensations rather than performance. Use guided classes or apps. Track reactivity to triggers that week. Weekly 1 to 2 sessions. Therapeutic integration. Session 1 of evidence-based therapy. CBT, DBT, trauma informed, or a support group. If therapy isn't available, use structured workbooks or guided online programs. Bi-weekly or monthly meaning work, volunteer, creative project, or spiritual practice that aligns with values. Schedule one activity per month. Practical tools and tracking. Simple tracker. Daily mood 1 to 5. Sleep hours 1 stressor noted. Review weekly. Resources. NIH Emotional Wellness Toolkit for Resilience Exercises, Guided Mindfulness, and Semitic videos. 4. Practice. Risks, limitations, and safeguards. Not a substitute for clinical care. Severe trauma, suicidal ideation, or substance cases require licensed clinicians. Unproven claims. Some holistic modalities lack strong RCT evidence, prioritize practices with impartial support, mindfulness, movement, structured therapy, herbs and supplements. Check interactions with medications and consult a clinician before starting. Measurable outcomes after 8 weeks. Target 20 to 40% reduction in average daily reactivity. Improve sleep by 30 to 60 minutes. Clear sense of coping tools. Use your tracker to compare baseline versus 8 week. All right, guys, that's your A for today. I will be back on later for shows. So I will see everybody tonight for shows. Until then, Gator Wellness, take care, folks.